Welcome back. I'm here with Dr. Kahlil Andrews, and we're going to talk about a procedure called ThermiRase today. So this is really interesting. I'm noticing a lot of times when we talk with you, there's this word thermi that's before a lot of different kinds of procedures. So will you explain what that's all about?
Absolutely. So thermi is a device that allows us to deliver radio frequency energy for multiple applications. And so we can use it to tighten skin, we can use it for vaginal rejuvenation, we can use it to treat nerves, which is what we're here to talk about today.
Yes, very interesting. So let's talk about ThermiRase. What is that?
So ThermiRase is a treatment where we're able to map out the nerves that supply the muscles that cause frowning and the frown lines.
Okay.
And so just like Botox, where we use a chemical to weaken the muscle that causes those frown lines, Thermi allows us to deliver energy directly to those nerves, weaken those nerves so that we don't frown.
Interesting. Now you actually had this done.
Yes, I did.
And we have some pictures of you getting this done. So we're going to pull it up and you're going to kind of walk us through what we're looking at.
So a couple of weeks ago we went to Miami, and Dan Rivlin probably has done more of these treatments than anyone in the world. And so what he does and what we do when we do the treatment is that we actually map out the nerve to make sure that we're only targeting. Now this is an interesting picture, because what he did was he targeted the nerve specifically and weakened the nerve on the right, but I had not yet had the nerve on the left weakened, and so that's why it's slanted there. And so there's a video here that we can show, and we can see specifically that I can't make that frown anymore.
Oh my
and
gosh.
So we can see the before. One interesting thing that we have seen with Botox is that if you can't frown, there's a sort of a mind-body effect where they've done studies to show that patients' mood is improved when they can't frown as much.
When they cannot frown.
Cannot frown, exactly, sort of a mind-body effect. But if we take a look at the video here, you can see that before the procedure, had very significant activity in my glabella, and so you can see that frowning. I could frown very aggressively, but
You're
now
a good frowner. That's a great frown.
Yeah, exactly. but now
oh, here we go.
I
going to show.
I can't do it at all. So if I can go up and down, I can't do it. And so the nice thing about this treatment is it's permanent. Where Botox, there's a cost associated with it, and so you have to have repeat treatments every 3 or 4 months, where this is sort of a one-time treatment.
Very interesting. So you are actually concentrating in see, I can frown really good.
Exactly.
So, and you also work.
So we can also map out the nerves to the muscle in the neck called the platysma. And so this is a woman on the right side of the screen, or the left side of the patient. You can see that she did not have the treatment on that side, but had the treatment on the other side, and it can weaken those muscles that produce what are called platysmal bands, and you can basically have a rejuvenative effect. And so if we can combine this with our ThermiTight treatment, we can produce face lift and neck lift level results with minimally invasive procedures, no downtime.
That's amazing. If viewers would like to contact you, if they'd like more information, where do they need to go?
PCIplasticsurgery.com or 247-3800.
Very good. Thank you so much. Very fascinating. And I just love with you frowning in those. That's a great visual.
Sure.
Very interesting.